Hi everyone, it's board certified plastic surgeon Sean Doherty from Boston. And you're used to me talking about putting breast implants in, but I thought I'd talk about taking them out. So breast implants are amazing. They're well-studied, safe medical devices that can really positively impact people's lives. However, they're not meant to be in your body forever. So when should you take them out? Well, that depends on when you want to. So people's aesthetics change, and so ultimately patients' desire to have a more full breast might not be there. That would be a reason to take them out. There could be a complication with your breast. One could have issues with capsular contracture, even breast implant illness, complications from your implants that would necessitate them coming out. One could also just be over their implants, meaning they just don't need to have that fullness anymore and don't want to monitor their implants. In my opinion, all of those are very valid reasons to remove your implants. You want to go see a board certified plastic surgeon, so maybe it's your original surgeon or at least someone new to you that again is board certified. You want to speak to that doctor, talk about what your options are, and to get an idea of what your tissue may look like without implants. So your body is different now than it was when the implants were first placed. Women who gained or lost weight, had children, really will anticipate some changes to your breasts after the implants are placed. Some women may consider having a breast lift after the implants are placed to improve the shape of your breast. Lots of things to consider. All, in my opinion, should be done with the guidance of a board certified plastic surgeon. So, hope this was helpful. Speak to you soon.